this is my blood pressure checkoff. Blood pressure is defined as the tension of blood in vessels at different intervals. You can measure this by getting two numbers. One is the systolic, which is when your heart is pumping and the blood is flowing through the vessels, and the diastole, when your heart is relaxing. Your procedure, you're going to grab a cuff big enough. You're going to have them pull their sleeve up so that you can have direct skin-to-skin contact. You're going to put the markers where the artery is, and you're going to make it snug around the arm. You're going to put your stethoscope in. You are going to place the head of the stethoscope along their artery. Clip this up there. And then you're going to make sure that you inflate it above 180 at least to make sure that you get an accurate reading. Make sure the cuff is closed so that you can pump it up. And then once you get it above, you're going to slowly deflate it. And when you start to hear the first sounds, that's what you're going to mark as your systolic number. And you're going to keep deflating until you hear. It's going to be kind of loud still. You'll be able to hear when it's muffled. Once it starts getting muffled, you know that you're going to mark the sound that you heard before that. So for her, I got 112/72, which is pretty low, which isn't quite hypotension. Hypotension isn't bad. It's just below 120/80. This can be caused by training, such as athletes. You're gonna have a lower number of for blood pressure. Times that you're really going to be worried about hypotension is when that there's trauma or shock, or you're worried about internal bleeding or something like that. If it's over 120/80, that's going to be considered hypertension. There's different stages to hypertension, such as like when you should be concerned about it. This can be caused by like atherosclerosis, so like fatty deposits built up. Obesity, smoking, stress, those are all things that you're going to be worried about. You're going to make sure that you reduce the risk of errors possible. So this is making sure that your athlete is or your patient is comfortable. If they, just got done running or something and you're trying to get like a resting blood pressure, you want to make sure that they're calm down and relax. You're going to make sure you get a good cuff size. You don't want to constrict the blood flow more than you already are. I'm going to make sure that you have skin contact. So if they're wearing clothing, you're going to prefer to have them pull it up. You're going to inflate the cuff to like over 180 at least, so that you can, make sure that you get that full range. You're going to like properly position the stethoscope. So if it's, in an awkward area where you can't hear the thumping of the heart, then it's going to be hard to really get those values. You're going to avoid like additional sounds or distractions, just so that you can get that accurate reading.